Good morning, good afternoon, good evening, wherever you are. How are you doing, THG family? And if you're not a part of the THG family, I would love for you to take a moment, press the subscribe button, turn on your notifications, share the video out, and also like the video. And feel free to leave your comments down below. I just ask that you be respectful of others in the comments, because we all can agree to disagree, but we need to do it the right way. So again, welcome in. I'm gonna warn you right now. You see the title, so if it's something that you don't want to hear or know about or whatever, feel free to check out one of my other videos. I have a ton of them. There will be a video that's going to play when I'm done talking, and it's about a particular hospital that is in my city. Well, not really my city, but in my state. But I do go to this hospital for treatment at some of the doctor's offices there. A little backstory: I do have lupus. I found out I had lupus almost 19 years. It'd be 19 years in October. And it was shortly after I had my son. Just wasn't feeling good at all, and went and had blood work done, and then found out that I had developed lupus during my pregnancy. They said it would go away. It did not. So I'm dealing with that, and then I also have fibromyalgia, and then I was continuing to have extreme pain. It was like down the center of my spine. So they referred me out to an oncologist, which is at this particular hospital, and they did blood work, and some of my levels were high to the point where they wanted to monitor me every 6 months. So every 6 months I go in, I get blood work done, and I'm excited to see the PA when I go in, because that means my blood work is fine. There has been a time where the doctor walked in, and I was like, oh my God, what is going on? Because if the doctor comes in and not the PA, that means he needs to really talk to you about something that's going on with your body. So that's the little short backstory on that. So let's get into this whole why you wearing a mask? Why should you wear a mask? I've seen a few comments in there, and respectfully, I explain why, I wear my mask. I just didn't go into detail, so that's why I feel like I should do this video to go into detail, because I do have a lot of new subscribers / family members, or people just stopping by. So I thought I would share that piece to let you know why I do wear my, because I have more than one underlying condition. Once again, I do have my notes because I want to make sure I get everything in. I may leave some things out because there are some things that don't really need to be talked about. So let's get into that. Things are gradually getting worse when it comes to, when it comes to that. Things are getting worse. The numbers are going up for cases. The hospitalization rate is going up. Even among children, it is getting bad. So I watched something the other day, and they were talking about in Arkansas how their children's hospital is really, really full with a lot of those patients, and they're suffering really bad. Some are being intubated. So there goes the debate. Should I not? And if I do, why I gotta wear a mask? So hopefully the video that I show after this will help you maybe decide if that's what you want to do or not do. It's still your choice. You have a right to do what you want with your body. That's how I feel. But for me, I decided to get vaccinated. My family got vaccinated. For one, they're asking for it when you go to college. So I definitely had to get my son vaccinated. That's where we are on that tip. There are many myths out there about why people don't get it, and I'm not here to debate that at all. Some of them sound really out there with the myths, and some of them have really good points with the myths as to why they're not getting it. So whatever you decide for your family, yourself, whether you even choose to disclose it in the comments, you don't have to. I'm not asking you to tell me if you are or not. It doesn't matter to me. I won't judge you. That's not the type of person that I am. But I do have people that come in the comments and they judge things I say. They judge, and that's fine because I'm on a platform and you have a right to do that. Just be respectful when you do it, because I'm not the one. I'm not the one. I'm nice. I'm nice, but I am not the one. And I don't like when people go after my other THG family members who are just expressing their opinions but doing it the right way, and then you say a little smart remark to them. I don't like that, and I don't want to have to go in and remove your comments, but I will if it continues. So I'm going to say I want you to continue to prep. I had a series of videos where I'm going and I'm doing like fall decor and stuff like that. That's just a way of not having to, I was still prepping those days. I still did videos about prepping, but I wanted to not have the focus of my channel be just prepping, because that can be overwhelming. And in actuality, you need a mental break. And you need to be able to step out and do something that is going to de-stress you. It's going to make you feel good. It's going to send those endorphins through your body, And for me, I love fall colors. I love decorations for fall. I used to own a child care center, so that time of the year, I really enjoyed creating and making the rooms look good for the kids. And if I could keep a Christmas tree up all year because it just brings so much joy, I would do it. I sometimes leave my tree up until March. So I'll put it up in November actually and start decorating it with items for fall. And then I'll take those off, change them up, do the same thing for December. Do the same thing for January. It's like winter. You're doing white and snowflakes and stuff. Just, because it really makes you feel good when you walk in your house. Now imagine being locked in, if they do a possible lockdown, and you don't have those items at your home that you can make it comfortable while you're there. Yes, you have your preps. You've been prepping. You have your food. You have your generators. You have all those things. But then you look around and it's like, I need something to pick me up. I'm going crazy up in here, So think about that when you're doing your preps as well. And that's why I did those videos, just to show you, you can step out and do something different and still get your preps done. So if things continue to go at the rate that they're going with the spike in numbers, don't think for a minute that they won't try to give us a little lockdown. You know what I'm saying? Oh, it's just a little small lockdown, whatever. It's just for this amount of time, just to bring the numbers down. You know how they did. Let's keep it real. That's how they did it. And in case they do that, prep now, y'all. Just do what you can with what you have. Stretch those meals out. Whatever you got to do when you do your meal plan before you buy your items, try to get those things together in your mind and write it down, what you're going to do, what you need, and how many days that can last you. Like if I make some chicken and dumplings, that's going to last me about 3 days, honestly. So that's taking pretty much half of my week right there. So that's less food that I'm having to use. So kind of think on those lines, Also think on if, there are food shortages, because what happens globally affects us. Whether or not they're having shortages in other countries affects us. Whether or not the store hours are made shorter, because you saw some of the restaurants that I went to, they have shorter hours because they don't have the workers. Either people just not able to work, or they're just sick and they calling out. You don't know the reasons behind some things, but everything affects us. Everything affects us. So let's be smart about how we interact with people, because we are going in and out of these stores. I have not been to the mall though. I'm just kind of don't want to do it, but be smart about it. You know, some places require you to wear a mask now, so just wear the mask. You know, it's just for that time. It's not going to hurt anything. Take it off as soon as you get out the store. You know, unless you're in California, I think they have it now where, and you can let me know in the comments if I'm wrong, where they want you to wear it while you're outside too. Y'all, it's hot out here. Nobody wants to wear their mask while they're outside. So if I feel like you're a good distance from me, then I probably won't have my mask on outside, but definitely inside. I'm not going in any store, in anything without my mask on. I don't care how you look at me. I don't care how you perceive me to be. You know, like that lady handed me that pamphlet, and she only handed them out to people that were wearing masks. Mind you, she didn't have a mask on. So, you know, she gave me the mask, and she did step off from me. She gave me some distance, and I appreciated that. And you know, you can respect me, I can respect you, I can hear you out. I don't have to be rude and shut you down, because you have a right to state your opinion. It is what it is. So y'all, I'm gonna leave you with this video. I just want y'all to know, I don't judge whether you wear a mask or not. I don't, you know, judge what political side you're on. I don't care. At the end of the day, we are all people. Everything that's going on affects everybody. It doesn't matter if you're on this side or that side. Right in the middle is a combo. We are in it together. We ain't getting out of it without each other. And as soon as we can realize that, we can pretty much eradicate what's going on. When we can realize that we need each other to stick together and not apart, we can get through anything. So y'all, stay safe, stay blessed, stay prayed up. I love you, but God loves you more. He created only you. Be the best you that you can be. And when you are, you can go out and spread God's love with distance. Y'all take care, and I'll see you in the next video.
A year ago, the COVID ICU at Lexington Medical Center was pushed to the brink. This week, doctors say it's feeling like deja vu.
We could very easily be back in a similar situation.
This man is the newest COVID patient admitted to the ICU, and Dr. Philip Keith is trying to figure out if he needs to be on a ventilator.
There's a very high likelihood he'll require, you know, more invasive care.
Around the corner is another COVID patient, just 26 years old, receiving a plasma exchange because some of his organs are failing.
A week ago, there were 0 COVID patients in this hospital's ICU. Today, there are 9, and 4 of them are on ventilators, the vast majority unvaccinated.
Obesity would be their only probably diagnosis of some. Others have no conditions at all, and otherwise really the only link is that they're not vaccinated.
Almanzo Cromer was one of Dr. Keith's COVID patients, hospitalized for nearly 2 months. Almanzo was eligible to get vaccinated early in the year, but didn't. Now he'll tell anyone who will listen.
Go ahead and get the vaccination, because the COVID is for real. Like, it had me on my dying bed.
Statewide COVID hospitalizations have increased by 103% in less than a month.
What I would ask from our community is, again, continue to understand the vaccine. The benefit outweigh the risk 100 to 1.
Ellison Barber, NBC News, West Columbia, South Carolina.
The new CDC internal report not only acknowledges that so-called breakthrough infections are rising, but that they may be as transmissible as unvaccinated cases.
Were you surprised that you had been vaccinated and got sick anyway?
Yes, absolutely. I was
Catherine
surprised.
Grego in Florida is still in isolation after testing positive about a week ago. She was vaccinated back in March.
you can still contract the virus and you can still get sick, but you're not going to get as sick as you would if you had it. So I feel like I'm very fortunate.
The CDC stopped providing public information on total breakthrough infections in late April when the tally hit 10,000. Instead, it only posted data when they led to hospitalization or death. So NBC News reached out to all 50 states. 38 responded. We found more than 125,000 fully vaccinated Americans have tested positive for COVID. According to a CDC internal document, there are now roughly 35,000 breakthrough infections per week. Keep in mind, that's a tiny percentage of the more than 160 million fully vaccinated Americans.
If you are vaccinated, you have 25 times less chance of getting hospitalized or dying.
In Provincetown, Massachusetts, a COVID cluster of 882 cases is linked to the Delta variant. The CDC analyzed nearly 500 of those infections. About 3/4 of them were in people who had been fully vaccinated. Just 4 were hospitalized. In Los Angeles County, during the first 2 weeks of July, fully vaccinated people made up roughly 26% of all new infections. Martha McAdam, a kidney transplant recipient, was vaccinated in February but came down with COVID in March. She was hospitalized for 48 days.
If I hadn't had that vaccine, I wouldn't be alive today.
And that's why public health experts say the vaccine works despite breakthroughs. A Yale University study recently submitted for peer review estimates that here in New York City alone, the vaccine campaign has prevented 250,000 cases and 44,000 hospitalizations.
I am recording. What? Oh, I ain't going nowhere yet.